Please welcome my guest today, Marsha Fowler, who holds a PhD in ethics and a master's degree in nursing. She is a Fulbright scholar and has been active in ethics for over 50 years. Her newest book has received a first place award in the American Journal of Nursing Book of the Year Awards. I was going to ask you questions too about the Department of Education capping student loans for nurses, also for social workers, physical therapists. The list is long, but if you look at the list of professions that are being capped, they are majority female professions. What are your thoughts on that?
I would say it's wrong-headed, probably absolutely damaging both to nursing education and to the health of the public that we are charged to protect. I think that once you cap the loans, it means that graduate education is going to be far more difficult. It's a good way to reduce nursing to a technical vocational occupation.
Right. Without master's programs, doctoral programs for nurses, then, as you say, we have no teachers, we have no clinical nurse specialists. An excellent hospital would be one where there is a clinical nurse specialist on duty at all times of the day.
I would agree.
They barely exist anymore, given the way hospitals run.
Well, the corporatization of healthcare is devastating. It's an expression of the healthcare system not wanting excellence in nursing, but wanting somebody to do tasks, basically. Once you cap the loans, it means that graduate education is going to be far more difficult.
Right. So now the only people who will be able to go to graduate school are wealthy people?
Privileged people. Mm-hmm.
Yeah. Yep. Will tend to be white. So this seems to be anti-diversity.
Looks that way.
Inclusion, right? And it seems to me like the other professions were also capped just at twice the range. And I don't think anybody is going to be able to afford graduate school the way everybody is capped. So medical school, or used to be male-dominated professions, are not as capped, but still they're not going to be able to pay for their whole tuitions.
Mm-hmm.
They're not going to have enough professionals.
But it's also a climate that disdains higher education. Higher education has always been a threat because higher education leads to critique, particularly where higher education also involves some knowledge of the humanities, which are a reflection upon human experience and are thus dangerous because they critique what goes on in society. It's the humanities that critique the sciences.
Heritage Foundation put out this document focused on getting rid of these loans. And they also talked about women getting higher education, delaying having a family. Their document, it was all about, we shouldn't need so many people with bachelor's degrees anymore. We didn't used to need them in 1960.
Yeah, I mean, it seems to me that it's counterproduction. If your agenda is the stupidification of the populace, but what it does is it creates a lower paid workforce, which I think serves to benefit specific sectors of society and the society that authorizes the existence of nursing. We have then a duty to society to live up to that authorization, but also to critique what goes on.
Well, thank you, Marsha. You have been so wonderful to enlighten us.